I want to thank you for inviting us to testify today on VA's efforts to ensure that veterans have timely access to health care through its scheduling systems. As requested, I'll briefly summarize our prior work on VA's scheduling environment and the related challenges for VA providers, schedulers, and veterans. In FY 2023, VHA provided roughly 71 million appointments to veterans. VHA also provided roughly 47 million appointments with non-VHA providers through the Veterans Community Care Program during that same time period. In doing so, the department uses a patchwork of systems that have been developed in ways that make scheduling with both VHA and non-VHA providers difficult for veterans and staff. Additionally, VA has experienced IT challenges related to the outdated, inefficient nature of systems and its efforts to modernize its health information system. VA has dozens of systems and tools that support scheduling appointments, managing referrals, and monitoring wait times. VistA facilities primarily use VistA scheduling, but it may also access at least 9 additional systems in the process of scheduling appointments with VA providers. VA operates another 5 systems used by staff for managing referrals and another 8 systems to engage with veterans about medical appointments. So that brings a tally to 22 systems. Oracle Health facilities have another set of scheduling systems, 14 in total. And they use some of the same systems that VistA facilities use as well to schedule those appointments and manage referrals. So adding to that tally, that's a total of 36 systems right there. Additionally, VA employs tools for monitoring scheduling timeliness, providing estimates of wait times on its public website, and determining a veteran's eligibility based on wait time for community care. Given this environment, schedulers and veterans are experiencing challenges when making appointments. Facility staff must open multiple applications to schedule a single appointment, and as you said, then they got to get on the phone and make those phone calls. They must also run reports in different systems to identify veterans' self-scheduled and self-canceled appointments and appointment requests. Navigating this complexity makes schedulers inefficient or require workarounds that may vary across sites. And VA has told us they are working to standardize veteran appointment scheduling at VistA and Oracle Health sites, but they have not yet determined how the modernized and updated products used for scheduling will interface and be pulled and combined with the data into a comprehensive report. So consequently, the result is a labor and resource intensive process for VA staff that has continued to evolve over time. Our work has shown that less than 40% of facilities scheduled more than half of their community care appointments within VHA's 7-day standard. Further, fewer than 10% of facilities scheduled more than 75% of appointments within the standard. In 2020, we recommended that leadership assess community care staffing and resource needs and develop a plan to address any identified risks to their ability to schedule timely appointments. VA concurred, but the department has yet to fully implement it 6 years later. Veterans have also experienced challenges requesting an appointment online, getting confirmation once an appointment is scheduled, and receiving duplicative appointment reminders. VA is working toward having one enterprise-wide solution to address these issues, among other things. VA's OIT and VHA have also been collaborating to address its scheduling system challenges. They initiated a project to modernize these systems at VistA facilities, which includes several concurrent efforts. For example, one is intended to allow provider-based scheduling, which is the ability to see a provider's schedule across multiple modalities. So that's like in-person and telehealth in a single application. VA is also deploying EPS for VA schedulers to schedule veteran appointments directly online with community care providers, and deployments have been in progress since 2024. In May of last year, we reported that while OIT and VHA had employed some key planning practices for the overall modernization effort, there were still gaps, such as accounting for the full scope of IT work in the project schedule and fully developing a requirements management plan. To this end, we made 2 recommendations to address these gaps, and moving forward, it will be critical for VA to fully and effectively implement the open recommendations we have related to scheduling, which is 6 in total. And doing so will enable VA to provide more quality, timely care for our veterans. And that concludes my statement. I look forward to your questions.